specifically, I had to speak about epilepsy surgery in a genetic condition for which seizure freedom is expected, because we now know that there are some conditions for which seizure freedom is very infrequent to obtain seizure freedom. So, for example, channelopathies. But there are other conditions. For example, I spoke about tuberous sclerosis, cerebral disease, neurofibromatosis, for which it is possible to obtain seizure freedom in 60% of cases. That is not as high as temporal lobe epilepsy surgery, but is however over 50% in children that are severely affected by epilepsy. So there are some red flags, but it's important to discuss about surgery and to send patients to third-level centers as soon as drug resistance is established. So exactly in the same way than in other diseases, after the failure of two anti-seizure medications. In general, there is a great interest towards, a great and growing interest towards genetics and epilepsy surgery. There are more and more papers describing small series with genetic of patients with genetic epilepsies have been operated and are seizure-free. And also there is the idea that it will be better to include genetics into the presurgical evaluation. So that genetic testing become routinary in the presurgical evaluation as well as EEG or other type of ancillary tests. Because we know now that, for example, focal dysplasia may have a genetic cause, and both somatic mutations, so mutation that you can find only in tissue, but also germinal mutation. And so it is important for somatic mutation, you can know before surgery, at least at this moment. Yes, in future, probably it will be possible to, in the near future, to examine also other tissues and to define also the somatic mutation, but at the moment, at least, you can inform about constitutional mutations. And for example, to know if the patient has genes of the mTOR pathway, or even other types of genes that gene mutation that, on the contrary, can negatively affect the outcome. Sometimes you discover this after surgery and after CVG. While in this way you can know before surgery, perhaps decide not to operate or to operate in a different way, to introduce other kind of ancillary tests and so on. So it's very important.